Hi, my name is Michaela Davis, and the article I will be discussing is entitled Nutritional Challenges in Metabolic Syndrome. The purpose of this article was to show how macronutrients influence metabolic syndrome, both in the development and resolution of it. However, there is no one-size-fits-all treatment for any one person in the treatment of metabolic syndrome. But first, let me explain what metabolic syndrome is. It's a combination of risk factors that lead to the development of cardiovascular disease and type 2 diabetes. These risk factors include an elevated waist circumference, hypertension, increased fasting glucose levels, high triglycerides, and increased high-density lipoprotein cholesterol. However, studies show that the main underlying cause of metabolic syndrome is insulin resistance. Metabolic syndrome is a very common disorder that is prevalent all over the world, especially in populations with low physical activity and high caloric intake. It is estimated that 25 to 35% of the adult population worldwide has metabolic syndrome, and almost 80% of type 2 diabetes patients have metabolic syndrome. But to be clear, not every person that has metabolic syndrome has insulin resistance, and not all people with insulin resistance have metabolic syndrome. However, those with metabolic syndrome have a 100% increased risk of cardiovascular disease and a 150% increase in all-cause mortality, and have a tripled risk of developing diabetes. Research shows that a 10% reduction in weight within the first 6 months is usually the first main goal and intervention in the treatment of metabolic syndrome. Several studies prove that the outcome of reducing weight, even moderately between 5 to 10%, resulted in reductions of blood pressure, glucose, triglycerides, and total cholesterol levels. Moderate weight loss also improved insulin sensitivity between 30 to 60%, which is even a higher result than insulin sensitivity medications. Also, evidence suggests the dietary changes coupled with physical activity are effective at treating metabolic syndrome and have led to a reduction in the risk of insulin resistance and cardiovascular disease. Some strengths of this article point out the benefits of including each macronutrient in the treatment of metabolic syndrome. For instance, eating low glycemic index carbohydrates, including healthy fiber, are beneficial. The glycemic index ranks foods containing carbohydrates according to how they change blood glucose levels. When the GI, or glycemic index, is low, 55 or less, that particular food causes a lower and slower increase in blood glucose and therefore insulin levels. Eating healthy mono and polyunsaturated fats are associated with lower risk of developing type 2 diabetes by about 40%, of course limiting saturated and trans fats. And eating lean, healthy proteins are associated with increased satiety and the preservation of lean body mass during weight loss. This table breaks down how each dietary pattern studied helps with the treatment of metabolic syndrome. As you can see, the Mediterranean diet, the DASH diet, the vegetarian plant-based diet, the low-carb diet, and the low-fat diet all have different variable benefits in treating symptoms of metabolic syndrome and lowering risk of type 2 diabetes. The weakness is that there is no one diet or exercise plan that works universally for every single person. The author concludes that results show that the different dietary patterns have variable effects on each risk factor for metabolic syndrome. but all of them must feature caloric restriction, which has been proven to be the most effective intervention for metabolic syndrome. My conclusion, similarly, is that one size does not fit all, and that adherence to a healthier lifestyle and dietary pattern is most important because it can significantly reduce the risk of cardiovascular disease and diabetes, and is more important than sticking to any one diet religiously.